to It's Your Case, presented by VetCT.com. I'm Amy Zalcman, your radiologist on demand for this week. We continue this month's theme of pulmonary patterns. It's time to take a breath. Our journey continues through the 4 broad classifications of pulmonary patterns. As a reminder, it's always important to keep these findings in the context of the patient history and exam. A short commentary is included after the case about the pattern. Today's example is a 10-year-old female neutered Dobermann Pinscher who has marked swelling of her distal left antebrachium and pain with palpation of her radius. Clinically, she is suspected to have a bone tumor, so screening radiographs of her thorax are pursued. Multiple small, round, soft tissue nodules are noted throughout the pulmonary parenchyma. These nodules are variably sized, but measure up to 2 centimeters in diameter. The largest is magnified on the left lateral view, where it is non-dependent, and slightly more sharply marginated on the right lateral view, where it is closer to the detector. This suggests that it is within the right caudal lung lobe. The cardiac silhouette, pulmonary vasculature, mediastinal structures, pleural space, and diaphragm are normal. The included musculoskeletal structures are normal. The stomach contains a moderate volume of gas and a small volume of dependent amorphous mineral opaque material. Our conclusions for this patient are multiple soft tissue opaque pulmonary nodules that likely represent metastatic neoplasia. Fungal granulomas cannot be entirely excluded if the patient has an appropriate travel history or lives in an endemic area. Unfortunately, there are diffusely distributed and variably sized nodules throughout the pulmonary parenchyma. With a high suspicion for osteogenic neoplasia, pulmonary metastatic neoplasia is the principal differential. Other categorical causes of nodular interstitial pattern include infectious pyogranulomatous infections such as fungal or parasitic, and occasional immune-mediated diseases such as eosinophilic bronchopneumopathy. Interstitial patterns encompass a large range of manifestations from unstructured to structured diseases. The reason for this is that the pulmonary interstitium is comprised of alveolar wall, basement membrane, pulmonary capillary endothelium, and perivascular and perilymphatic structures. Pathologies implicating these areas can generate disease that will be classified as interstitial pattern. Structured interstitial pattern commonly refers to nodules when uniformly ranging between 1 and 3 millimeters in size is called a miliary nodular pattern. Alternatively, the generic nodular interstitial pattern is applied more broadly. Nodular interstitial patterns can include neoplasia, such as metastasis, infectious diseases that can include fungal, parasitic, or bacterial granulomas, inflammatory diseases, or less commonly, cysts. Bulla are categorized differently. Miliary interstitial patterns have a stronger association with specific fungal and metastatic neoplasms, although these are not exclusive. Be sure to view the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.